Welcome to another podcast of Veterinary Compassion Project. I am Dr. Erin Holder, and today I'm here with Sara Wilkins. Sara is a licensed veterinary nurse who graduated from Michigan State 28 years ago. She is certified in critical anesthesia and pain management, as well as palliative care. Sara spent the majority of her career in anesthesia, but was also very passionate about her time spent in medical oncology and clinical pathology. Sara is a yoga teacher with certifications in trauma-informed sensitive yoga approach, athletic performance, as well as yin and chair yoga. She is also licensed massage therapist and certified in Reiki for both humans and animals. Welcome, Sara. Thank you so much for spending time with us today.
Thank you for having me.
So, the big question is, were you one of those people who always knew that veterinary medicine and working with animals was going to be your path, or did it come to you like it did for me later in life?
I knew from a very early age that I wanted to work with animals. Yes.
And
So
so, what did that look like? What was your path? Tell me in your own
yeah,
words.
yeah. So my path was passion for animals, starting from a very early age. I explored as a teenager, where would I like to dabble with this animal passion, and I got a dog when I was about 17. My parents did not let me have a dog before then, but I finally talked them into it, and I fell deeply in love with this dog. And when I got the diagnosis later on in his life that he had bladder cancer, it really shuttered everything that I was thinking about doing. And I wanted to figure out a way to help him. So I decided to start to work as a kennel aide in a veterinary hospital. And before I knew it, I had two jobs as a kennel assistant in veterinary hospitals, and everything just kind of blossomed from there. I fell in love with the medical side of animals, and I loved to see the healing and the preventative care and everything come together. So that's kind of how my journey started. I quickly became a veterinary assistant and loved that and explored the options. And 28 years ago, a vet tech, it was quite an interesting experience to even find that career. And once I did, I applied to Michigan State, and the rest is history.
Oh, that's wonderful. Yeah, like me, when I finally realized I was in college when I decided that I wanted to become a veterinarian, and I too went back to the kennels and started in the kennels. And there is a very palpable and certain amount of energy when you get to see your dream be realized and start working with animals. And I remember cleaning the kennels with such gusto and such excitement and talking to all I actually sang, not well at all, but I love to sing. And I would sing to all the animals as I was working. And it's very palpable excitement. And so it's really shocking when you find yourself one day exhausted and not wanting to go to work anymore. And obviously, we created the Veterinary Compassion Project to sort of to talk about it and combat it and, form a camaraderie of all those people in a very difficult profession. So, because we're here today to discuss compassion, fatigue, and burnout and what you did on your journey, when was it that you sort of realized that it just that zest and excitement was starting to leave? Was it immediate or was it insidious?
It wasn't immediate. It honestly was about 10 years in where I started to feel some feelings of compassion fatigue, but not knowing the title of that or any of the symptoms that come along with that. I just knew something wasn't right. Um, and I didn't really do anything with that. I knew I was moving at a very fast pace in my career and that I wasn't doing anything for self-care with my mind or my body at that point. But again, found myself in a position of overdrive and always on 24/7, even if I wasn't at work. I put myself out there as somebody in the veterinary community, and I didn't have boundaries.
Mm.
So, and at that point in it, I didn't understand what any of that meant. But I did know that I wasn't taking care of myself. So it was a culmination of those things.
It is really something in this world, the overdrive, the drive it takes to get into the world, the drive it takes to stay in the world, the drive it takes to graduate from veterinary school. And in all that, we tend to isolate ourselves and we tend to put on this sort of false bravado that everything is okay, that we're okay. And we do put ourselves last very often. I'll take care of myself eventually, but I got to do this, and this first until splat. Um, you realize that you better make some changes and you better make them quickly. So for you, tell me about that moment when you took a turn towards realizing that if you don't prioritize yourself, then you may not stay in the field.
Yeah. So after Michigan State University, when I was working there, I found myself back in general practice. Um, and I found myself in a great position of being director of surgery and anesthesia, exactly what I wanted to do, my love, my passion. Um, but the sheer amount of responsibility that came with that title, um, and the actual money that I was making, again, put me in a position of finding that I was compartmentalizing constantly. I was going from one thing to the next, to the next, to the next, without even processing information or emotions, or even physically that I maybe needed a bathroom break or some food.
Right.
Um, but I still continued on that overdrive. I didn't take a step back because this is what I needed to do for my career. My career came first. My career out of the chute came first before anything, and even myself. Um, the moment that I started to notice that I don't know how much longer I could actually do this was when I found myself in a pretty dark place. And I didn't even recognize that I was in that dark of a place until I opened my eyes. And I just remember being in the middle of a major triage with a dying animal, and the people around me incredibly emotional. And I personally was heading up this triage, and I had zero emotion. I couldn't cry. I couldn't find any sort of emotions to describe what was happening. And I actually remember looking up at this particular, it was a cat, and looking into this cat's eyes and thinking, I don't want to do this. I can't help you. I, in fact, feel like what I do is essentially um, setting you up for never finding mercy. So I felt like I was a liaison for basically setting these patients up to survive this event. And for what? Were they still going to have quality of life? Were they going to go on to be happy, healthy companions? I didn't know that because we worked with a lot of rescues as well. And
Mm.
so I felt like I was causing more pain than harm at this point. And I just couldn't find any joy, but I also couldn't find any sort of emotion. And that was pretty terrifying.
That was really beautifully said. And I don't think there's one of us who have been in this profession long enough who hasn't experienced some sort of feeling, maybe not that they don't have any feelings exactly, although that is a clear indication of exhaustion, but that they're not responding like they should, or they're responding, dramatically, too dramatically to these situations. And so listening to you say that is, hopefully somebody will hear this podcast that maybe can identify with that and say, oh, okay, yeah, this is exhaustion. This is not able to process the emotions like we should be able to. So after that incident, when you felt like, I don't feel anything, I can't do this any longer, what happened?
Yeah, that's a great question. And stop me if I get too lengthy on this one. Again, not recognizing the depth of the abyss that I was personally in. I kind of lingered there for about 3 years when I look back on it. I desperately needed help. Um, so I went to my doctor, I went to management, I went to anybody that would listen to me to try to reach out for help. And I didn't really find the help that I was looking for until one day. Um, I went back to my doctor and I said, I'm extremely depressed. My body hurts.
Mm.
I don't want to even continue on. Like, I don't know what else to do though. This has been my life. I made it my life, my passion. I need help and I'm at your mercy. And I remember my doctor looking at me and she said, have you tried yoga? And I got really upset with her. I was like, that's it? That's all you've got? Have I tried yoga? No, I haven't tried yoga. I'm on the brink of, trying to figure out an exit strategy for my life. And so no, I haven't tried yoga. And she said, I want you to try yoga and I want you to call me back. And I was super upset with her, but I was so desperate that I said, I will try anything at this point. So I went to my first yoga class and I thought it was weird and strange and hokey and all of the words that you could use to potentially describe your first yoga class. And I went and then I called her and we checked in. I said, I tried it. I don't know. And she said, you know what? I want you to go to another one. And I don't want you to call me back until you've gone to at least 5 more and then let me know how you're doing after that. And so I did. And I went back and I kept going back. And I remember finding some peace. Shavasana, we all know if you've taken a yoga class, that the best part of yoga is Shavasana, that end where you
Indeed
get
it
to,
is.
yes, yes. And I remember laying there and I just started sobbing. Like my
Mm.
body didn't have to move, my mind didn't have to move. I actually found some peace, but I was still in this dark abyss. And I remember going back to work and again, having to be on point all the time and having to work 14 to 16-hour shifts and having to manage and be director of something. You're constantly going, go with zero breaks. And the next major triage happened as it does. And this particular moment, I had clients watching. I had a whole team that I was directing, and I had a dog dying,
Mm.
and it was mass chaos. Um, and in it all, I remember as I was intubating this bulldog, um, my mind went to yoga, and I don't know how, and I don't know why, but in the middle of this chaos, my mind went to yoga, and I was able to get through this triage. I was able to block out every horrible thing that my mind was telling me. I made it through. My patient did not make it, but I was able to actually comprehend what was happening, process what was happening. I stepped away from the emergency when it was all said and done, and I was able to breathe. And that was a pivotal point for me because um, that whole time, all of those years had gone by when I constantly did a triage almost the same circumstances, and I didn't let it go. And it just built, cumulatively built and built and built. And this time it felt different. And I couldn't put the words into what was different, but I just knew that I felt calmer this time. And so my journey continued into yoga. And now my work is as horrible as it was for me personally. I could manage bits and pieces, bits and pieces. I was dissociating at work. I was doing everything I could to avoid. I was the typical avoidance. I actually went to the owner of the hospital to say that I can't participate in any more euthanasias. I can't. I can't be a part of it. And so anything that had to do with death at this point, I completely avoided. I would grab somebody else to deal with it if things were going bad. And that also wasn't good, but it was, I now know that it was a protective mechanism. But when I would walk away from that particular case, obviously it was in good hands. I would go to that place with yoga and I would start to take a few breaths and just step away from the situation. And slow but surely, it helped me until I was able to reach a point where I wanted everybody to feel this way. Like this was life-changing for me. And that didn't mean I wasn't still in that dark abyss. I had no idea how deep I was into it at this point. But yeah, that's a very long answer.
No, it's actually quite beautiful because there's a lot of important things I just want to circle back to. And one is when we're in such a fast-paced practice and small animal, large animal, whatever animal work that you do, often a fast-paced, busy because there's not enough of us. And there's so many people that just love and care for their animals so much, and abandoned animals we have to help, that we often remove ourselves from our own body. Like we do kind of dissociate so that we can get through the day. We almost sometimes are like watching ourselves as we do these things. And it's the most beautiful thing that when you said that you went into Shavasana where you could finally cry, and I suspect it's because of everything you said, but also because you're finally totally attached to your body in yoga, and you're finally one, and you are able to now release um and I talk a lot about meditation, and when we meditate and we have all these thoughts and things, it's just our body pushing out the stress. And so your body was able to start the path of healing, and then your mind knew how it felt to be in your body. And so that when you were in that emergency situation, you were grounding yourself with yoga, you were pulling yourself back in, you were staying attached to yourself. And it was just the really be like, I got chills the whole time you were talking because of your description of it, because I feel so kin to that. And when I get out of vet school, I started having panic attacks in vet school. And I didn't know what was, I just thought, well, this is a lot and it's stress, and that's what's going on. And when I got out of vet school, I started a yoga practice, started learning yoga, and I'll never forget my yoga instructor. I was trying to do the tree pose and I was just falling over and over. And my yoga instructor came up behind me and just put her hand on my shoulder, and she just whispered to me, "Your life is out of balance." And I was like, my first reaction was like, bitch,
Yes.
And then my second reaction was like, oh yeah, you might actually be right. And this was 30 years ago, or 25 years ago. I carry that with me to this day, that she said that, and it started this beautiful love of yoga for me, and meditation. So I deeply identify with you in that. And we talk about yoga and what it can do for you. So tell me, so that was your wonderful experience, and you realized I can do this. And then tell me how the rest of the journey unfolded in your self-healing.
Yeah. So as my journey continued to unfold and I made the decision to go back to school to learn to become a yoga teacher, I also started to dive into the parts of myself that may have caused me to sustain an environment like I did. And I'm talking about veterinary medicine as a whole. Um, and what does that even mean? It means as I heal, as I gain knowledge, as I gain self love, self respect, um, through yoga and through a lot of therapy, that I can now start to recognize um, the things about the industry that are not healthy. And that was very, very profound for me. Um, and even though I did play a part in my own suffering through working on the shadow parts of myself, I also learned that all of it wasn't on me. There was a huge portion of this that is on the industry. Um, and that's a second pivotal point in my entire career when I could take a step back and start actually listening to other people and processing information, seeing my team as they were, connecting with other veterinary professionals outside of talking about medicine, and starting to see the sheer and utter burnout taking place, not just with myself, but with so many colleagues, nurses, and veterinarians alike. Um, and so it pushed me to continue this journey. My main goal of becoming a yoga teacher was to spread this feeling of liberation across the veterinary industry as much as I could. And then continuing to learn more and more and more, I said, it's not just the veterinary industry. This needs to be for everybody, for
It is.
anybody
It's the
feeling this
world.
way.
Yeah.
Yeah. And so I became healthier. I looked at the parts of myself that weren't steadfast in my own boundaries. And again, my own self-respect, and that very fine line we walk in veterinary medicine of professional and personal life. And I started to draw those boundaries and really stick with them. Um, and that's a very hard thing for anybody in the veterinary industry because you do get pushback. You end up being the person not so easily manipulated at this point. No, I do want to go home when I am supposed to get out of work, and I do need a break. I do need to eat, and it can't look like 1 or 2 minutes or 5 minutes. It needs to look like a 30-minute break or whatever we agree on. And no, I won't be able to see the next emergency that you decided to take on our lunch hour. So, all of those things cumulatively made me stronger, um, helped me to see that I don't need to sustain an environment in an industry that, we throw the word around toxic a lot. Abusive might be a better term because we do find ourselves when we're saying yes, we find ourselves in a position of being exploited. And so I learned the sentence no, and no is a complete sentence. And it changed my life. And that, again, through the philosophy and the teachings of yoga and meditation, I learned that I also count. And I don't need to be on point every minute. I don't need to sacrifice my personal time for my professional time. Um, and I just let go of having to know what comes next, having to know what my life's going to look like in a year, having to have goals. I surrendered to what was happening, and I decided to let it unfold as it were. And so, um, when I continued my journey and found myself with a really good therapist, who was able to listen to me and connect the dots of what morally is right or wrong, and I could feel heard, um, that was life changing for me too. That, I'm not the problem because I can't continue to work 16-hour shifts or take on more responsibility, or you name it, or continue to be exploited. Um, and that was so profound for me that, I did recognize the burnout at that point and the compassion fatigue. And that when my therapist told me, you could write the book for this, like literally, she said, word for word, you are the poster child for CPTSD and vicarious trauma. And so I didn't know what any of that meant at the time either. And I dove into that with going back and becoming educated on what it means to have a trauma-informed yoga practice. So not only was I gentler with myself even, but gentler with the community around me.
It's beautiful. What is it about us in this profession that, I mean, is it just our complete and utter devotion to the animals that lets us blur the boundaries so drastically?
Yeah,
And
it is. It's that passion, and for whatever reason, I've found that our passion is driven in different ways towards animals, right? So for me, I found that my passion for animals was probably escaping some childhood things, some childhood trauma. So I threw myself into animals because, I mean, I think all of us in veterinary medicine could probably easily agree that our dogs and our cats, our horses, whatever pet you have, whatever pet you're treating, we get that unconditional love from those animals. So whatever drives that passion for each of us, I think could be different. Nonetheless, it's there. And so when we take that passion on and make it our career, we walk a very slippery slope because we're setting ourselves up for that exploitation and for that potential manipulation of the conditioning of what we actually need to do in this career. And being passionate, what I've learned, um, also means that if we're not passionate about who we are, we can't give our very best to our patients. Um, and it also doesn't mean that you're not passionate if you don't stay for that next emergency or work, an extra weekend or don't take your lunch break. It doesn't mean your passion isn't there. It means you're human and you're trying to survive an industry that says if we don't do constantly, we're a failure in this industry. If you're not constantly on point, if you're taking your PTO, you're a failure. If you're not giving yourself a break, you're a failure. And that's absolutely not true to anybody that's out there. Take your breaks, stand up for the boundaries that you have as a human being. We have biological needs, and it does not mean you're a failure in any way.
And I feel like for certain, I believe it's top down in culture and it starts from the owners and the veterinarians, but and I cannot escape by, this beautiful conversation without talking about management, in which you were. And, as I was an owner and maybe didn't pay as close attention to the day-to-day operations or the lunch breaks or things like that as I should have handed that over to a manager. Um, it is critical to have a manager, a human resource advocate that is educated in this.
And unfortunately, in this industry with virtually no limits and no actual standards of care. We all have our own standards of care, and as an individual hospital or GP, I think everybody strives to have that standard of care. But because there's no industry-wide standard of care that's enforced, it can be a free-for-all, even for management. And I found myself in a middle management position, a working manager on top of the responsibilities that I had. So advocating for a team with a manager ahead of me who didn't have boots on the ground, didn't have an education or formal experience in the veterinary industry, which made it really difficult because we came at things more with a standpoint of maybe a retail feel. And unfortunately, that's not, it's just not
The
how
service
things.
industry, correct. Yeah, this is not a retail industry.
Yeah. So it's really hard. So from the management point of view, even just a restructuring of how we manage, and of course, being in that position, I understand there's that fine line with business, and you have to make money, but then we fail as an industry to uphold standards because we do have that business mind and we do need to make money. So we do jeopardize the mental health and the physical health of our staff when money becomes more important. And and that sounds like a very generic umbrella statement, but I remember asking multiple times, what is our goal financially? Like, what do we want to do short term, long term? And let's come up with a plan to make this feasible so that the staff can be healthy and so the staff can function properly. If we have an emergency hospital available to us and at 5:55 we decide to take on 3 additional emergencies, and at 6 the emergency hospital opens, and now we're asking, half of the staff to stay. What are we really doing here? Now that happens, right? That happens all the time. If we have to stay occasionally, sometimes we don't have control over the circumstances. But when you find yourself spiraling every single day, that we're taking on extra, we're taking on more, we're asking people to do more, and it's only, a couple minutes into your lunch break, and it turns into your entire lunch break, and then it turns into a culture.
Mm.
That's where we have the problem. And what is the solution to that? The solution needs to come from the top down. You're correct. And I believe that the industry standard needs to start with the AVMA.
And it also needs to come from within. So we do need to have stronger technicians, nurses, doctors on the floor who feel comfortable and confident in saying, no, like I need this or I need that. And so I think all of those things. And we have to be very careful in our elevation of technicians to management. I think that's something that we do as doctors and owners because we are thinking that this is the right solution. And while it certainly can be sometimes, it's just often these guys are not trained properly in HR and how to care for the staff.
Yeah.
So I think at VCP, like we're trying to reach the individual to say that you can make a difference and you can change your life, whether you stay in your job or not, and hopefully that you stay in the veterinary profession, but you can learn to set those healthy boundaries and you can learn to get yourself help. I will finish up. Our time is drawing to a close. Sadly, I've had a wonderful time, talking to you and hearing your story. I identify so much with it. But before we go, just impart your hope, and what you're doing now, and how different your life is now to us, please.
Yeah, absolutely. So continuing on the yoga industry and finding that extreme peace in my life, and surrounding myself by some other individuals outside of the veterinary world, um, I drew closer to this feeling of extreme peace. My passion also lies in pain management. How can I make the world pain free? Because I feel like we live in a very painful world sometimes. And so, in exploring that, I found massage therapy and started diving into some of that and found myself back in school to become a massage therapist. Um, and actually, yesterday just celebrated 2 years in the industry and
Yay.
love it. I get to take away pain all the time. My clients are extremely happy. Um, but I also, my first year out doing massage, I also stayed on in the veterinary world for 1 day a week. I wasn't ready to let it all go. And that gave me a pretty deep look at the extreme differences in the industry. I would come home on my day in vet med completely wound tight. And I'd come home on my days with massage pretty carefree. And so this last January, 6 months, I officially retired from veterinary medicine, only doing massage and yoga and Reiki. And I don't have any stress. I can go to work. There's your regular stress of getting there on time and doing your job, but I've never felt more liberated in my entire life. And I feel like I'm doing really, really good things for a lot of people. And going back to the veterinary industry, all of it, no matter who we talk about, what we talk about, animals, clients, patients, management, it does start from within. And we have to find those parts of us um, through a lot of work, therapy, in whatever modality, yoga, exercise, meditation, breath work, sound bowls, all of it. What parts of us allowed that to be okay in our life? Where did we go wrong with boundaries? And dig into that and know that there's hope. There's other things out there. If you're in the veterinary field too, you choose to stay in it, taking care of yourself. The exercise is so important. The finding other people outside of the veterinary industry to make friends with. Just letting go of that part of things, enjoying your own pets. This is the first year I've enjoyed my own pets after 28 years, taking them for walks and but knowing that there's hope. You're not stuck. If you're having thoughts of suicide, there's so many resources now. There's so many like what you're doing, the Veterinary Compassion Project. People like my counselor. I'm going to throw a little accolade out to her, Blue Dog Counseling. There's hope, and you can manage yourself in the veterinary industry. Again, doing some things for yourself, giving yourself that self-love, and yeah, making sure you're taking your bathroom breaks and drinking a lot of water.
I genuinely cannot thank you enough for coming onto the podcast, for your vulnerability, for your honesty. I am delighted in your journey and hope this is a um, platform that others can jump from and have that wonderful journey as well into healing, trauma, trauma healing, healing in the veterinary world, and being able to move forward and stay in the veterinary field if they want to, or move on to find something that's makes them more happy and more peaceful. And if you're listening, this is our whole retreat. This is what our retreat is all about. We are going to introduce a lot of concepts to talk to you about how to find this inner peace. And for me, it was balance. And so, ever since that day in yoga class, I've been looking for and trying to find balance. And interestingly, I will share this story before we go. I told my husband as we're in California, I went to my first yoga class. And of course, as the universe brings you what you need, she says, today we are going to be focusing on balancing. And I thought, oh shit, like I haven't done yoga in a year. I've been moving, like, oh, here we go. And I almost cried because I got into those balancing poses and I could hold them better than I ever could before.
I
And so
love
I
that.
just got out so delighted and told I'm like, oh my God, I can balance. Like, this is so exciting. And so it really, like, I'm getting teared up, even talking about it. So it really, I understand intimately what you speak of. And again, I thank you so much, Sarah. And I
Yes,
will
thank you.
love to stay in touch with you and follow your journey. So thank you.
Absolutely. And what a beautiful metaphor for balance, bringing your life into balance and then balancing in yoga class is
Right?
absolutely
And it was
wonderful.
accidental.